It is currently 2:35 a.m. Sleep eludes me constantly. Doctors are always putting me on different stuff, whether it be medication or pills, or it's always messing with my sleep. Most recently I was taking these pills for, I don't even know what they're for, but then they were like messing with my head, like I was like not really fully there. Anyway, so I stopped taking them, and since I stopped taking them, now I can't sleep. So let's just say that insomnia is my middle name. Not actually. Just, could be.
Retiravam da corte para ali passarem o tempo despreocupadamente.
Dos veados selvagens para se alimentar. Doctor today. Went to the doctor. Over the past year, several different doctors have done all sorts of different tests. All the blood work you can imagine. Lyme's disease and autoimmune and AIDS and everything. And fortunately or unfortunately, depending on how you want to look at it, all of those tests came back negative. That is to say, all the blood work, it all appeared to be good. Everything seems to be working properly inside of me, which is sort of good news, but there's also a part of me that almost hoped they would find something wrong with me, because then they could attack that and fix it, and then I'd be better. The fact that nothing appears to be wrong with me is scary, because it's, well, what do we, if there's nothing to fix, how am I to get better? So the sort of rough theory that the doctors have been going off is this idea that I have some sort of anxiety, this sort of like generalized anxiety that's sort of ever present, that causes everything to just take so much energy out of me, that's just constantly exhausting me every hour of the day. Which sort of made sense, but it also didn't, because I'm not a very anxious person. I don't worry about anything, I don't stress about anything, I just want to live. I just want to be able to live a normal day. And I just physically can't. There's just something inside me that's not working right. In any event, over the past year I've been on 4 different anxiety medications. They all could have been sugar pills. I didn't feel anything on any of them. And I did therapy, and none of the therapists really said anything that I hadn't thought of before. And in any event, I really think it's time for a new theory. This anxiety thing I just don't think we're gonna get anywhere with treating this as anxiety, because I really don't think that's what I have. I think that if anything, I've probably experienced a bunch of anxiety as a result of whatever's wrong with me, because I've been so desperate to just live a normal life, and I've just been desperately unable to. So I think that's caused a lot of anguish inside me. It was like, what in the world? Why can't I just live? But it really makes more sense that that's sort of a secondary effect that's happening because of something else, rather than that being the main source, the main issue, the main... All this to say that we have a new theory as to what's going down, or at least I have a new theory, and today I brought it to my doctor. Chronic fatigue syndrome. No, wait, is that what it's called? Chronic fatigue? Check this out. Chronic fatigue syndrome. People with chronic fatigue syndrome have fatigue that is very different from just being tired. The fatigue can be severe. Yeah, I can't get through one day without laying down. It's not a result of unusually difficult activity. Yep, no matter what I do for that hour when I'm upright, whether it be going on a bike ride or just sitting in my apartment, within the hour I will have to be laying down again. It's not relieved by sleep or rest. It helps with the symptoms, but it doesn't improve it at all. And was not a problem before becoming ill. Yeah, I used to play sports and was active and went to school and did all sorts of normal people things. So all that stuff really checks the boxes, but this is the part that really got me, that really makes me think this is promising in terms of a diagnosis. Okay, it's this thing called post exertional malaise. People with CFS often describe this experience as a crash, relapse, or collapse, during which symptoms get worse. It may take days, weeks, or longer to recover from a crash. Sometimes patients may be housebound or even completely bedbound during crashes. And that's exactly what I was talking about yesterday. When I go out on those bike rides that are longer than an hour, that are for 2 hours or 3 hours, then I'm unable to even go outside at all for days or even a week or sometimes even more. But I got really, really tired of having to spend 3 days, 4 days, a whole week without being able to go outside at all. So now I'm really, really strict about making sure to keep those bike rides nice and short. So the good news is that I really feel good about this diagnosis. Well, I guess it's not a diagnosis yet, but this idea of that this might be what's wrong with me. Because it just feels so much more on point than the whole anxiety thing did, because it never really felt, I just don't feel like I have anxiety. So that's the good news. The bad news is that there's no cure as of yet for chronic fatigue syndrome, which is mildly terrifying. What there is Stanford University has a really good, one of the best programs ever, dedicated to trying to learn more about this disease and whatnot. So my doctor is going to refer me to them and yeah, go from there. And even though there isn't a cure, so to speak, that works for everyone, it would feel really nice to be sort of at somewhere where they're definitely on the cutting edge and they're doing research on this every day, and they're really gonna take their time trying to diagnose me, and they're not just gonna ship me off with some anxiety pills and check in with me a year later. If anyone's gonna be able to figure this out, I'm pretty sure they are, so. Yeah, some good, some bad, just, you know, day by day. It's just life, you know, so not too worried about it.